So the stitches that you use, are they dissolvable, or do we have to come back to get them out?
The deep stitches are dissolvable, the ones like further inside that you don't see. The ones on the surface come out at 5 days or 6 days typically. So I don't like to go like shorter or longer than that if I can avoid it. That's like kind of a good window there, 5 to 6 days, because you want it there to give you strength, but you don't want them there long enough to give you like railroad track
Holes,
marks.
yeah, okay.
Yeah, so yeah, and the suturing there is, it's a very kind of critical sort of area, so it's just done very meticulously, very small suture there.
Okay, yeah, because I spoke to someone who said that they give you dissolvable stitches on the top as well, and I didn't really feel comfortable with that.
I will rarely do that for my patients who fly in from like other countries. If they like, they don't have anyone back home who can remove them, and it's just not safe to send them back with stitches that are just permanent. So that's an exception. I tell them that's not my preference. For all my local patients, it's not even a question. We just, do Prolene is the permanent stitch that I use. Yeah, I mean, it doesn't make sense to use dissolvable on everyone because if you think about it, it's dissolving because the body's attacking it, right, to break it down. As it attacks, it causes more inflammation and redness, and just it doesn't make a ton of sense.
Yeah, and I mean, I'm not a surgeon, but I didn't know if it would be maybe even scar a little more.
It could, yeah. I mean, it's very possible. So I try not to take that chance, when I can avoid it. But the deep stitches are always dissolvable because you don't want to dig anything out. So
Right.
those are a bit, stronger too, but they dissolve. I use a mix of two different types of deep sutures, just depending on where I need more strength and if I can get away with a suture that's less strong. And the reason is because that dissolves faster. So it's a little bit easier for the recovery. So you're kind of like balancing. You can use very strong deep sutures, but then they take forever to dissolve. And then sometimes you get little bumps that form as it's dissolving because the stitch can unravel and sort of come out the
Mm.
skin. So I've moved away from the really strong stitch all across, and I try to kind of balance the two, a stronger stitch and a less strong stitch next to it. But it's for that reason, to kind of create a slightly more tolerable recovery.
Oh, okay.
So
Great.
it feels less tight for less period of time, because it's always going to feel a bit tight here for like, it could be months. Sometimes it's weeks, but it could be months until it starts to, open up again.
Right.
So, but I don't want people forcing past that tight feeling, because that's what it's doing as it's healing. So you don't want to kind of force it open and then create problems at the incision line. But it's
Yeah,
not typically something that bothers my patients.